Welcome to the UK Health Corps headquarters, home to a dedicated team that works hard 7 days a week to keep all of our students, faculty, and staff safe and healthy. One of our key functions at Health Corps is serving as campus's hub for accessing information related to COVID-19 testing and support. Over the past several weeks, we've received many questions from our community members, including parents and families, and we're excited to highlight key members of our team who can answer some of these most frequent inquiries while giving you a better sense of what we do in Health Corps.
Health Corps is an integrative approach to community-based wellness for faculty, staff, and students. So we talk with each one of those people. We're contact tracing for each one of those people, and we're providing resources. It's high tech, it's high touch. We use technology centered around human interaction and personal attention so that we can reach every person and have more time talking with the person and providing their resources as opposed to worrying about the technology side of it. We've got that covered, so it allows us to do that. It's the University of Kentucky's response to the pandemic, and it's going to keep us safe and healthy during this time.
We have 5 sub-teams here at UK Health Corps. Our first one is the contact tracing team that uses CDC standards for contact tracing. Contact tracing is the process in which we identify who a positive case has been around and who they exposed so that we can get those individuals to quarantine. So this reduces the spread of COVID. We also have our wellness connectors here at UK Health Corps that does a wraparound wellness support for our students and staff, which includes getting them connected with any resources that the university can provide. We also have our academic coordinator who does wraparound academic services, which could include excuse notes, coming up with study plans, talking with professors, just to make sure our students aren't struggling academically while having to isolate or quarantine. We then have our facilities team that provides support for our students who live on campus that need to isolate and quarantine. They facilitate their transportation to isolation dorms, provides meals for those who have to isolate and quarantine, and make sure that they have the necessary accommodations. And then finally, we have our communications team, which is the Q&A hub for any questions our campus community might have involving COVID, our safety measures, response, and anything else.
So every contact tracer has completed the Johns Hopkins COVID-19 contact tracing course. We've also shadowed the Lexington Health Department as well as UK Healthcare in their tracing. And then we all come from a variety of backgrounds as well. So we've got university administration, facilities, public health, healthcare, had some people worked in COVID labs here. So we have that experience and knowledge to provide accurate information and to have that one-on-one relationship with students.
We feel that we have a very strong hold on managing the virus. It began with educating people through the Daily 4.0, which is required by everyone coming to campus regularly. From there, it grew to an understanding of the community as well as care through others and for self. We also have seen lower infection rates throughout the entire semester, and we've received praise both nationally from Dr. Burks as well as locally from Commissioner Stack.
We are constantly improving and updating our resources and procedures for our entire campus community. Everybody who comes onto campus is expected to follow the Daily 4.0. Everyone must wash their hands. Face coverings are required in all public spaces. Physical distancing is expected everywhere, including in classrooms. And everybody who ever comes to campus this semester must complete the daily screener.
If you, as a student, faculty, or staff member, feel that you have been exposed to or have tested positive for COVID-19, please stay at home and immediately contact Health Corps at 859-218-7233. If you have any other further questions, please feel free to contact your primary care provider or University Health Services.
The expectations for students coming on campus this semester are the big 4.0, the big 4. daily screening, wear that mask, washing those hands, and most importantly, social distancing. We also have the required testing for students on campus, so that's the required flu shots, as well as following the Health Corps protocol, which is the contact tracing. Like I said, additional testing when needed.
Isolation is when you test positive for COVID-19 and lasts a minimum of 10 days. A quarantine is when you're exposed to someone who's tested positive for COVID-19 and lasts a minimum of 14 days. For both isolation and quarantine, you need to stay home and avoid contact with others, not going to school, work, travel, or any public location.
Yeah, the University of Kentucky takes additional steps beyond the notification and contact tracing process, really to wrap our arms fully around our students who must isolate or quarantine. And that begins with outreach and ongoing support from our team of wellness connectors who follow up from those initial contact tracing phone calls to make sure that students have a range of supplies and necessities that will be essential to them, continuing life and being well or getting well while in isolation or quarantine. So those wellness connectors can manage anything from helping to support Wi-Fi needs to making sure that dietary restrictions are met in food deliveries, to making sure that prescriptions are picked up if those are necessary components that a student needs while in isolation or quarantine. Beyond our wellness connectors, we have our academic coordinator, who's a full-time individual on our team, specifically focused on making sure that students who feel well enough to continue their classes while in isolation or quarantine are able to do that, helping them through logistical hoops and other barriers that might stand in their way of seamlessly continuing that education while in quarantine or isolation. Our facilities team here in Health Corps manages a series of isolation halls that are residence halls specifically equipped to support students who are isolating because they're COVID positive. We also have students quarantining, right, as high exposure contacts in our residence halls in their private bedrooms. For students both in those isolation facilities and who are quarantining in their residence halls, there's regular food service delivery that we initiate here in Health Corps, provided by our partners in dining services. Regular laundry pickup, making sure that students who are isolating and quarantining can have those basic needs met in terms of their laundry being done and returned to them. And we also have a nurse practitioner line available after hours to students who have urgent but non-emergency COVID-19 symptom-related questions. They can always pick up that phone and reach a nurse practitioner from student health. So those are some of the many ways that we reach out to wrap our arms around our students in isolation or quarantine and make sure that they're supported in remaining or getting well.
Yes, absolutely. Surrounding campus, there's 28 plus different delivery options that appeal to all nationalities, dietary preferences, and even budgets. That also includes an array of grocery markets that also offer contactless delivery. So, those students are lonely. They love any kind of interaction they can get, even if it's just something warm and delicious to eat, as well as care packages, definitely. We do have contactless delivery where those packages can be delivered on campus to the front desk, and they are delivered to the students in a timely manner. So it's definitely a pleasant surprise.
We abide by all guidelines set forth by the Health Insurance Portability and Accountability Act, or HIPAA, and the Family Educational Rights and Privacy Act, or FERPA, which exists to protect your students. That means for HIPAA, it ensures that all medical records must be kept private, and FERPA ensures that all academic records will be kept private too. All Health Corps staff have received HIPAA and FERPA training, which means that all medical and academic records will only be shared directly with their students.
Anyone can report COVID-19 noncompliance, and they can do that by visiting the Office of Student Conduct website, which is uky.edu/studentconduct. Our Health Corps team works very closely with our Student Conduct team in making sure that we gather information and pass that on in a systemic and actionable way. The compliance components related to Health Corps include making sure that students are in contact with us if they need to be, that they're responsive to Health Corps, that they additionally are participating in their screening, doing mandated testing, complying with the contact tracing process for their safety and the safety of those around us, and complying with flu vaccine requirements.
Along with the Centers for Disease Control and Prevention, our public health and infectious disease experts have guided us through this entire process of reimagining how we conduct operations on campus this semester. Every step of the way, they have provided recommendations, and that began with COVID-19 testing for all of our students coming to campus. Recently, they've also recommended that all students on campus receive flu vaccinations. According to the World Health Organization, vaccinations are one of the most effective ways of preventing and protecting against influenza. And just as our top priority this entire year has been the health and safety of our community, part of that is reducing the strain on our healthcare professionals and our healthcare systems. For those who have concerns or would like more information, please don't hesitate to reach out to UK Health Corps as soon as possible.
Thanks for spending time with us in Health Corps. We hope you now have a better understanding of UK's response to COVID-19 and our commitment to keeping our campus safe and healthy. For more information on our COVID-19 response, visit uky.edu/coronavirus or call us at 859-218-SAFE.